Hello, my name is Deanna Cheatham, and today I'm going to provide a presentation in regards to my literature review, which is titled COPD and Associated Nutritional Deficiencies. So here's just a brief review of what I'm going to cover with my presentation. I'm going to give you a brief introduction of what COPD is. I'm going to go through the pathophysiology, the disease etiology, clinical manifestations, which consists of the signs and symptoms, the treatment programs that are out there for COPD, and generally a summary of overall recommendations that have been established, and finally my references. So initially, I want to talk about what is COPD. The abbreviation stands for chronic obstructive pulmonary disease. And basically, the disease slowly restricts airflow into the lungs due to the inflammation of the lining of the bronchial tubes and also the destruction of the alveoli. Unfortunately, it's one of the third leading causes of death in the United States, and it's an estimated of 328 people having it worldwide. And because of the status of the disease and how it progresses, it decreases the quality of life for those patients. And usually towards the end of the stages of COPD, you have to have supplemental oxygen in order to help you breathe and function for daily life. So a lot of times it usually leads to hospitalization or supplemental care. So first, I want to give you a brief description of what happens in a normal, healthy person's lungs. So whenever you breathe, when air travels down the windpipe or the trachea, down into these bronchi, two of the main branches that lead into your lungs. And then it goes off and branches off again into the bronchioles, and that's these other branches. And the tiny little sacs that look like little bubbles are called alveoli. And I'm going to describe as to what they do exactly a little bit later on. So this is the main organ that is affected by COPD, but because it affects the lungs, it subsequently leads to further maladies and other micro and macronutrient deficiencies, and it affects the overall equilibrium of the body, such as acid-base balance. And it also causes major damage to those alveoli walls that I just told you about, and that's what is the biggest issue with COPD. So COPD is kind of made up of other diseases. The main two is chronic bronchitis and emphysema. So chronic bronchitis, those two bronchi that branched off into the bronchioles, those main branches, bronchitis is the inflammation of those branches, and it causes excess mucus and muscle constrictions. So even getting the air inside is really difficult, and it makes them feel like they can't breathe because the air cannot get to the alveoli, which are these tiny little sacs. And whenever those are degraded and not working properly, it's called emphysema. So if we look to the right over here, you'll see this is a cartoon picture of what an alveoli does. So this is the air sac right here. So lung comes in from the lungs and then it comes here. And this is where the gas exchange of oxygen and CO2 occurs with the blood capillary and vessels of the body. And oxygen is taken in and CO2 is released, and that is how oxygen is taken through the rest of our body. And so this is the most basic function of the lungs. So if we are having complications with that, that's what leads to further issues for the other organs of the body. So I want to talk about the disease etiology. What causes it? There's a multitude of factors. Some physical factors that are kind of without your control is number one, your low body weight. If you're malnourished or underweight, they say that you have a higher risk of experiencing COPD. Age is also a major contender. Almost all diagnoses happen at least after 40 years of age. And genetics is actually kind of a small percentage, 1% of people who are diagnosed with COPD. They have a issue with producing the alpha-1 antitrypsin protein, which is also abbreviated as AAT, and that this is a display of that protein. And so basically, their lungs, and its main role is helping play a big defense role in the lungs. So because they're missing that gene, it causes damage to that alveoli and the bronchial tubes, and then that leads to the development of COPD. So once you're diagnosed and they realize it's because of that deficiency, they can prescribe you AAT supplementation, and that can prevent further damage. However, it cannot treat or help the damage that had already been done to the lungs and the lung tissue. Some environmental factors, meaning things that you do or you surround yourself with, is the main cause of COPD. The number one reason for the development of COPD is tobacco smoke. In addition to that, you also have industrial dust, chemicals, and fumes. So if you work at a plant or anything like that, you're at a higher risk. But now for tobacco smoke, like I said, it's the number one reason. Even if you smoke for 20 years and then you stop, you're still at risk. And it's good that you stop, but it's just the particles that you breathed in did so much damage that the body will continue to fight off that damage and leading to that inflammation of the lungs. So even smoking one cigarette can lead to the risk of developing COPD. So clinical manifestations, here is just like what I explained earlier, that COPD is made up of different diseases. Here's the chronic bronchitis, emphysema, and then there's also asthma. And so it's just this collaboration of this difficulty to breathe. So you would experience shortness of breath, wheezing, needing to clear your throat constantly, and chest tightness, and then this just prolonged chronic cough that you'll produce mucus with. And blueness of the lips and fingernail beds, this is for more of the severe cases. This is where you are legitimately not getting enough oxygen that is traveling to your fingertips and the external extremities of your body. You'll experience lack of energy due to that lack of oxygenation, unintended weight loss, and swelling in your lower extremities. So there's various forms of treatment. I'm going to first cover the medical treatment. And the first thing that they always recommend is to stop smoking and and if you are exposed to a plant or an industry, stop exposing yourself to them. So then they combine it with different educations and therapeutic exercises. So a lot of times they'll pair therapeutic exercises with nutritional programs to help them maintain or gain weight that they had lost. And the main medications that you'll see is bronchodilators and steroids. And what they do is they help relax the muscles that are constricted around the bronchial airways. And then you'll also have combination inhalers. Here's the phosphatidylase 4 inhibitors I talked about for the AAT protein deficiency, theophylline, and antibiotics. The antibiotics are mostly prophylactic because they are already at a higher risk of developing other infections. So antibiotics are mostly to help keep those at bay. Now, because they're on such a constant dosage of steroids, that can lead to other micronutrient deficiencies, and I'm going to discuss those a little bit later. So medical nutrition therapy, there's a lot of things that we can do to help the symptoms of COPD. The main goal is to preserve body weight. Because you're coughing so much, you'll have a lack of appetite, you'll have early satiety, you just won't want to eat as much as you need to, and your body's already needing an increased need of protein and energy because it's dealing with a lot. So our main goal from the nutrition standpoint is to preserve body weight, lean body mass with protein, and just the general well-being, because like I said, the progression of disease is going to affect the quality of life. So we're really going to focus on omega-3 fatty acids, vitamin D, and calcium, protein, and energy and nutrient-dense foods. Now, as I said, the extended exposure to steroids can lead to the depletion of both vitamin D and calcium in the body, and it can cause the bones to be porous and less dense. And because it has a major impact on the digestion and absorption of vitamin D and calcium, those suffering with COPD often face osteoporosis and are at higher risk for fractures. So at a micro and macro level, we need to focus on energy, as I said, and so we have an increased need. They should have 25 to 30 kcals per kilogram of body weight. For protein, it ranges from 1.2 to 1.7 grams per kilogram. And how you decide this range is if they're in remission or exacerbation of the disease. So if the disease is not very active at the moment, everything's not as inflamed, we can focus on the 1.2. But if you are having an inflammation episode and everything's worse and you are struggling to breathe and everything's inflamed, we would lean towards 1.7. Now, fluid needs is very important because when you drink more water, it can help thin the mucus that will always be there. So it can help the patient get it up and breathe easier. So it's important to get 2 to 3 liters per day. And nutrients of focus, as I explained, calcium and vitamin D, they're very important to focus on because of that constant exposure to steroids and the depletion of the bone tissues. And finally, antioxidants. This can help fight off those diseases, those nasty secondary infections that I talked about and how we take antibiotics. So if we can use our food and nutrients to do that, that would be much better because antibiotics can also be harsh for the body if you're using it constantly every day. So the lab values are affected very broadly, and it's interesting to see how they're affected because it's shocking and it's not what you would think it would be. So glucose is abnormally high, and there's so many theories as to why it is, and nobody really knows why, because I assumed it would be low because you need more energy, your body's using more, but it's actually high. And so they have many theories, but the most supported theory is that the metabolism is altered and it just causes the A1C levels to be skewed and abnormally high and greater than 7%. Now, sodium and potassium and calcium, they're significantly low. And a lot of times for the sodium and potassium, they believe that it's because of fluid retention, because as I said earlier, the lungs play a very large role in acid-base balance, and that could cause further damage to the kidneys, which could then put you in a renal failure state, which then causes issues with fluid retention, which then decreases your sodium and potassium levels. So it's this big domino effect. Your calcium is low. I discussed that because of the long-term utilization of steroids for helping those muscles relax around your lungs and your bronchial tubes. Your hemoglobin and albumin is low, and this is because of the effect on the respiratory system and the lack of oxygen getting to your blood. Your BUN and your creatinine is high. This is also related to the fluid retention and basically the lack of function that your kidneys are doing because of the damage that is being done. Your cholesterol and triglycerides are also influenced, and this is increased rates of high lipid panels, and it's just found to be a common thing with COPD diagnoses. Now, there's specific tests that are done for COPD patients, and this is for their specific situation. Arterial blood gas, or ABG, is the measurement of oxygen levels of your blood, so they can use this to see, are you in remission or is it really inflamed right now? How much oxygen is getting to your lungs and your other parts of your body. Your spirometry test is just, you breathe into this tube machine and it measures the lung function and lung capacity. So collectively, a lot of physicians will use all of these tests, not just one or two. They will look at the whole picture because a lot of people can get misdiagnosed with COPD. And so they look at this whole picture to, one, make sure you are, in fact, a COPD patient, and two, we can use this to help individualize your nutrition care. So that way we can make sure that we can meet your calcium needs and your potassium, sodium needs. So overall, as a dietitian, as a registered dietitian, and if you have a patient who's suffering from COPD, we really need to focus on the energy, the protein, really focus on that calcium and vitamin D to help stabilize osteoporosis and prevent fractures, because that can lead to further complications. We also need to focus on omega-3 fatty acids and antioxidants. So overall, we're going to combine all of these recommendations to focus on preserving their body weight and the muscle mass and reducing the risk for osteoporosis and doing our best to prevent the progression of COPD and improving their quality of life. Here is a list of references from all the different sources I used. And if there's any questions, feel free to email me or message me, and I will do my best to answer them. Thank you.